clock is operating here. Yes? All right. Watch. Yes, I am. Did you see the countdown? Just so you know, that's not the final countdown. Watch. Anybody? Anybody? I hate me too. Okay, here we go. See, watch. Watch. Do you guys like to be disappointed? Do you like to be disappointed? No, you don't. I don't like to be disappointed either, right? So when I put those videos online and I ask you to watch them and you don't watch them, guess what I feel? No, nothing. Nothing. I could care less. You will feel disappointed because if you don't look at them, then you're going to kind of be behind the 8 ball, you follow? Right? That's kind of like your introductory stuff. You got me? Okay. So let's finish up talking about the pH question, yes? And then what I'm going to do is I'm going to go over the CO2 and which way the equation goes again and say, yeah, you got me. Okay? All right. Now watch. Again, when we talk about pH, what we're really talking about is a balance between hydrogen ions and bicarbonate ions. Are you with me there? Anything that forms free-floating hydrogen ions is an acid. Bicarbonate is a base. It's alkaline. Or a player back in the 50s and 60s, a baseball player, alkaline. Alkaline. Okay. Are you following me so far? You're with me? Guys? All right. So in order to maintain the pH of the blood between 7.35 and 7.45, there has to be a balance between the free-floating hydrogen ions and free-floating bicarbonate. Say yes. So if you were to look at this little teeter-totter here, what are the two ways you could make the blood acidic? You could add more hydrogen, free-floating hydrogen ions to the blood, right? Or you could do what? You could remove free-floating bicarbonate. Say yes.
Where does the bicarbonate come from? Is that covered?
Bicarbonate is actually produced in the liver.
It's always present.
It better be, or you're in trouble. Tell me you got that. You're with me so far. Okay. How many people have ever eaten, I don't know, maybe a big greasy chili dog? Then you pound a couple of beers, and then you say, I'm tired. I'm going to bed. And then you start burping up. You ever do that? Okay. Watch. If you do burp up, what does the burpy vomit in your mouth taste like? It tastes like acid. Tell me you got that. So if you have uncontrolled vomiting, you are vomiting. Can I tell you, you never forget when you vomited. You always remember when you threw up. Not kidding, I remember 3 years old biting on the top of my crib, throwing up. I think it was pro-Sobi. So watch. In the case where you are vomiting uncontrollably, what are you removing from your body? Hydrogen ions. So there will no longer be a balance between the amount of free-floating hydrogen ions and bicarbonate. There will be a relative excess of bicarbonate in your blood. So what will happen to the pH of your blood? It will become basic. So if you throw up, you produce an alkalosis. Say yes, acidosis. You're following this? Okay. Now, what's the opposite of vomiting? No, not vomiting. So watch. You're going to learn something. Hang on. These guys right here are the large intestines. The large intestines are called large intestines because they're larger than the small intestines. Are you writing that down? Okay, watch. Watch. Bicarbonate is produced by the pancreas and dumped into the intestines.
Wait, what is bicarbonate?
Yep.
I thought it
The-
was kidney. I heard you say kidney in videos.
Where you actually make bicarbonate is in the liver. You store bicarbonate in the pancreas to neutralize the acidic chyme from your stomach. You got me? Tell me you're with me. Now watch. When you digest food, your pancreas releases bicarbonate into the intestines. Are you following that? Bicarbonate usually gets reabsorbed back into the blood in the large intestines. But if you are having diarrhea, yes, and you are crapping out all of your poop and water and everything, what else are you crapping out with it? Your bicarbonate. So if you crap out your bicarbonate before you reabsorb it back into the blood, where is it? What's going to happen to the pH of your blood? Right, because you are losing bicarbonate, so you will have a relative excess of free-floating hydrogen ions, which will lower the pH. That's how vomiting and diarrhea affect your pH of your blood. Did you catch that?
Does the chyme solidify the waste? Is that part of the process?
Yeah, I don't want to talk about that. All I want you to know is that bicarbonate gets reabsorbed in the large intestines. When we get to the digestive system, I'll explain that. Tell me you got that. Again, what I'm trying to explain to you is why people who have severe GI problems have problems controlling their blood pH. Now you know why. Say yes. How many people are with me? You're following this, right? So if you are having diarrhea, make yourself throw up so you maintain your pH. Here we go. Say yeah, you got that. Good. Watch. circulating in the blood and formed by your liver is this guy right here. What's that guy? What is it? Bicarbonate, right? Bicarbonate is the primary base of the body, boy, and it is a powerful chemical buffer. Are you with me? What's a buffer? A chemical buffer can grab free-floating hydrogen ions and lock them up. Tell me you got that. What's the only thing that can affect the pH of the blood? Free-floating hydrogen ions. So if you have an excess amount of free-floating hydrogen ions, what can lock them up and prevent huge swings in pH? Bicarbonate. Say yes. You're with me, guys? Okay. So the other thing bicarbonate can do is if there are not enough hydrogen ions floating in the blood, it can cause carbonic acid to break down to free-floating hydrogen ions and bicarbonate. So a buffer, a chemical buffer in this case, grabs those hydrogen ions immediately or lets go of them immediately so that you don't get huge swings in blood pH. Say yeah or no. Anything?
Yeah. Yeah.
What?
He said anything, I said yeah.
Tell me what, are you guys following this or not?
Yeah.
Are you? Okay. Rock on. So what's an example of a chemical buffer found in the body, boy? Bicarbonate. You got me? Now, that's one example. I'll give you another one in a minute. Let's look at this equation again real quick. Just so you know, when class is over, I have to leave right away. I'm going to my doctor. He told me he had a pill for me that would make me not care. So I'm going to pick up a whole handful of them and overdose this weekend. Watch. What system controls carbon dioxide? What system controls bicarbonate? The kidneys. You with me? Now watch. Watch. The kidneys control bicarbonate by either doing one of two things. Either peeing out bicarbonate or bringing it back into the blood. Tell me you got that. Are you following this? following it?
So the kidneys absorb and excrete the bicarb, but the liver is what makes it?
Yes. Tell me you're with me, you're following this. All right?
It's stored in the pancreas.
Yeah. Don't even worry about that. Don't worry about that. You guys are thinking way too much, right? Don't worry about that. Just worry about the fact that the respiratory system controls carbon dioxide and the kidneys controlled bicarbonate. You got me? All right. I'm going to give you a little problem here and see if you can figure it out. Again, this is kind of high-level thinking, and right? So don't blurt it out, just think through it. Watch. If somebody sticks a dirty sock that smells like Fritos, you ever have those kids where they don't wash their feet and they smell like Fritos? Watch. If you can't remove carbon dioxide from the blood, what's going to happen to the amount of carbon dioxide in the blood? It's going to go up, right? So if carbon dioxide goes up in the blood, which way is this equation going to go? It's going to go this way, right? And it's going to form more free-floating hydrogen ions. So what's going to happen to the pH of your blood if you start retaining carbon dioxide? It's going to what? You guys say it real loud. I got pounding and I'm deaf.
Acidosis.
Your pH is going to go down, right? You're going to produce an acidosis. Say yes.
Yes.
Is that good for you?
No.
That's bad for you. So the only system that can help out if the lungs ain't doing their job in this equation is what? The kidneys. Because the kidneys control bicarbonate.
Oh.
Say yes.
Yes.
That's not the only question. What would the kidneys do to bicarbonate? What would happen to the levels of bicarbonate if your lungs are not getting rid of CO2? The kidneys, if you're producing acid at the lungs, then the kidneys have to bring in more bicarbonate because acids and bases neutralize each other. Can I tell you? No disrespect at all. It's the same circus, different clowns. I get the same looks in my morning class. Did you watch the video on this? Did you? That's all I got. Tell me you followed this just a little bit. Yeah? Okay. Let me see if you followed it. Okay? Here's a cell. Who cares what cell it is? We don't care. Let's say this cell, for whatever reason, I'll tell you later in the semester, starts producing more hydrogen ions than normal and dumping them into the blood. You got me? in this case, which way is the equation going to go? It's going to, hold up. You got more hydrogen ions here. In order for the equation to be balanced on this side and this side, if you have more hydrogen ions, in order for it to be balanced, what do you have to have more on this side? CO2. Tell me you got that. You're with me. So if you increase the amount of hydrogen ions in the blood, what's floating in the blood that can bind with them and make them not free floating? Bicarbonate. And bicarbonate will grab those extra hydrogen ions that are floating around, lock them up in carbonic acid, and then carbonic acid breaks down to CO2 and water. Say yes. So if the equation is forced this way, right? What system controls carbon dioxide? Beautiful. So if you are making more hydrogen ions through metabolism, you got me? What's the only system that can help out in this case if the cells are making more hydrogen ions? The respiratory system. Yeah or no? So watch. Here's the second part. What would the respiratory system do? Watch. CO2 is an acid. You got me? So if you're making more hydrogen ions, you're making acid here, you have to get rid of more acid in the lungs. So you would have to breathe out more CO2. Yes or no?
Yeah.
So that's like with diabetics, they'll be peeing more or feeling like they have to drink a lot, but then also just pee a ton.
Hang on. I'm going to show you this, and then I'm just going to make a couple comments about it. Okay, let me show you this. This is a person who is in what's called a diabetic ketoacidosis. Have you ever heard of that? DKA, right? So watch, I'm now going to give you the example. In this case, the liver is making acid and dumping it into the blood. So what's going to happen to the amount of free-floating hydrogen ions in the blood? So which way is the equation going to go? It's going to go this way. You got me? In the favor of forming more CO2, correct? And the goal of the body is to maintain homeostasis. So if you're making acid at the cell, you have to get rid of acid at the lung. So the respiratory system has to breathe faster and deeper to remove that extra CO2 in an attempt to maintain the pH. That faster, deeper breathing in somebody whose blood sugar is really high and their pH is dropping is called Kussmaul breathing. So watch. This is a lady who's in DKA, and she's laying there, and she is breathing faster and deeper. She's trying to blow off that CO2 to maintain the pH of her blood. This is some high-level thinking, people. It is. But that's the type of level of thinking that they're going to expect of you. And if you don't know it, your whole career as a nurse is going to be left to try to memorize signs and symptoms of every frickin' disease, and you ain't going to do it. How many people followed this? Watch. Let's take a closer look at this. I don't want so much you to look at her breathing, but rather her facial expression, because this is what I see when I look out. You know, if you look at it, she maybe was a student in my class.
What's better, faster or deeper breaths?
I don't know.
Same.
Yeah, not really. I don't want to talk about it. Is that okay?
Sure.
All right. How many people followed that? You got me? So, simplifying this. What's the only system that can help out with a respiratory problem? The kidneys. And what's the only system that can help out with a metabolic acidosis alkalosis? The respiratory system. Tell me you got that. Yeah? For real? So, really? All right, here we go. I'm going to go over which way the equation goes one more time. This is what I want. You got me? I want this whole thing explained to me. Ready? Are you ready? Right now, it's 1:59. So, wait, it says 2 o'clock. So look for 2 o'clock on the video. Here I go. Ready? We know that the only place that nutrients and gases are exchanged in the body is at the level of the systemic capillary and the cell. Say yeah. Who cares what cell it is? Right? And that the arterial end of the capillary is high in oxygen. And you need oxygen in order to metabolize, make ATP aerobically. You with me? It's the best way to do it. Why does oxygen in the arterial end of the capillary go into the cell? That's right. So by diffusion, oxygen will move from the arterial end of the capillary into the cell. Say yes. A byproduct of metabolism, I'll explain that later. All you need to do is take this on a little faith. The big byproduct that you got to get rid of is carbon dioxide. Carbon dioxide is formed inside the cell. Why does carbon dioxide go from the cell into the blood? Right. High to low. That's diffusion. So you are adding carbon dioxide into the venous end of the blood, the capillary. Yes? If you increase the amount of carbon dioxide in the blood, which way is the equation going to go? It's going to go this way. Say yes. So, in normal physiology, if everything's working good, right? You with me? It's going to go this way. Say yeah. So, venous blood is more acidic than arterial blood because there's more carbon dioxide in it and CO2 is an acid. How many people are with me? Okay. And you need to know this. You have to know this. Where does all the venous blood in the body get dumped into? Where does it go before it goes to the lungs? Right. We'll just simplify it. We'll just say the right side of the heart. So all veins of the body dump their venous blood into the right heart. You got me? Where does the right heart pump that venous blood to? The lungs. Watch. What happens to the size of the pulmonary vessels as you move deeper and deeper into the lungs? They get smaller. And the smallest blood vessel you have in your lungs is called P. Diddy, or just Diddy. It's called a pulmonary capillary. You got me? What do you got to do in the lungs? What do you got to get rid of? CO2. Watch. Here it goes. Now I have a little drawing. Right, tattoo it inside left forearm, right here in Greek. Every pulmonary capillary is associated with a one-cell thick air sac called a what? An alveoli. So you have a pulmonary capillary, and you got our little equation that you love to hate. Yeah? Are you with me? What do you do in the lungs? You remove carbon dioxide. You blow it out into the atmosphere. So if you're reducing the amount of carbon dioxide in the blood at the level of the lungs, which way will the equation go? It will go this way, correct? The bicarbonate will grab the hydrogen ion. It will form carbonic acid, and it will break down to CO2 and water until both sides of the equation are equal. So what are you really getting rid of at the level of the lungs? Free-floating hydrogen ions. And if you get rid of free-floating hydrogen ions because you're getting rid of CO2, what will happen to the pH of the blood? It will go up. So that's how the respiratory system controls pH. Yes or no? A physiologic buffer is a system that helps control pH. So give me an example of a physiologic buffer. The respiratory system. And how does the respiratory system help maintain pH? It controls carbon dioxide. Yes or no? I want that whole thing explained to me. What I just explained to you. Do you follow that? Boom. Yes? You got a question?
Yeah, that H, what's this chemical name for H2CO?
Carbonic acid. Carbonic acid is found every day. If you drink pop, you're drinking carbonic acid. So you can say to people, hey, how's your carbonic acid today? Say it's good. That's why when you drink pop and somebody says something funny, like shoehorn, and you laugh, and you get it in your nose, it burns your nose, because acid is caustic. Yeah or no? Who's with me on this? Okay, so watch. Watch. What's the other system that helps control pH? And what does the kidneys control? Bicarbonate. Tell me you got that. So the two systems, physiologic buffers, respiratory system, and the kidneys. And you better tell me that the respiratory system controls carbon dioxide and the kidneys control bicarbonate. Can I get an amen? That's right. I define pH. Bless you. I explain why the pH has to be between 7.35 and 7.45. Explain in terms of hydrogen ion concentration the difference between these two pHs. Just so you know, I'm changing those numbers. Because you'll go home, that's 1,000. You got me? What's the primary base of the body? Boy! Bicarbonate. And when you write bicarbonate, you're going to write bicarbonate, the chemical formula, and the name. If you don't, I'm taking points off. Say yeah. What would happen to your pH of the blood if a person had frequent episodes of vomiting? I explained that. Diarrhea. I explained that. What is a chemical buffer? It's a chemical that grabs free-floating hydrogen ions and prevents them from being free-floating, or lets go of hydrogen ions and allows them to be free-floating. What's an example of a chemical buffer? Bicarbonate. Say yes. An int. I only gave you one. Guess what I'm going over now? The second one. See how easy this class is? How many people think this class is easy? Ready? Here we go. I'm going to answer two questions in one. Ready? Floating around in your blood, and it's only found in your blood. If it's found anywhere else in your body, something wrong with you. You got me? And the reason it's only found in your blood is because it's so freaking big. There is a big freaking protein in your blood called albumin. You got me? Albumin has many functions. You got me? One of albumin's functions is to transport electrolytes. You got me? The other function of albumin is it is a chemical buffer. So what does that mean? That means that it can either grab onto free-floating hydrogen ions or let go of free-floating hydrogen ions. Ain't that right? You with me? All right. So watch. How I like to explain it is I like to think of albumin as a bus. So let's look. We'll make it a little yellow bus. The short bus. And all we know is that the wheels of the bus go round and round. So watch. You have seats on the bus. You got me? So one of the functions of albumin is to transport calcium around in the blood. You got me? Are you with me so far? Okay. this is important. The only physiologically active electrolytes are the ones that are floating freely in the plasma. If calcium is sitting on the albumin bus, can it affect your cells of your body? No. Only free-floating calcium, just like free-floating hydrogens. Are you following me so far? So let's go back to our picture of the blood. But before we do that, the wheels of the bus. Okay. So you have albumin, and you have these little seats on albumin. You with me? Some have calcium. Some have hydrogen ions. You got me? All right. Watch. You have free-floating calcium here, and you have a hydrogen ion here. Hydrogen and calcium compete for seats on the albumin bus. Guys, what's more important, to maintain the pH of the blood or to maintain your blood levels of calcium? pH. Because if calcium was more important, I would have started talking about calcium first. And you did it right. So watch. If the cells of the body start producing more hydrogen ions than normal, so you have an acidosis, yes? These hydrogen ions are going to compete for the open seats on albumin. And who's going to win? Who's going to win? Hydrogen. So if hydrogen takes up that extra seat, what can't calcium do? It can't get on the bus. So what will happen to the amount of free-floating calcium in the blood if you have an excess amount of free-floating hydrogen ions? That's very good. That's very good. So, Ed, I know what you want to do. You guys want to take the path of least resistance, and I'm going to cut you off right now to make sure that you don't do that. What I'm telling you is that if you increase the amount of free-floating hydrogen ions, you produce an acidosis. And an acidosis leads to hypercalcemia, increased amounts of free-floating calcium in the blood.
So like maybe blood test, they would test for calcium if it's up. That means, got it. Okay.
Watch. If you write acidosis causes hypercalcemia, you're not getting any points. You follow that? You're going to explain to me why. Say yes.
Hypercalcemia is harmful, way more harmful than acidosis.
No, acidosis is more harmful than...
Right, that's why. What, like, what's the response?
Of hypercalcemia?
Yeah.
It will slow nerve conduction, slow your heart. Yeah.
And that's due to the calcium in the blood free-floating because the hydrogen went in the albumin, right?
Correct. So the hydrogen got buffered by the albumin because it's more important to maintain your pH than it is blood levels of calcium. So that will allow more free-floating calcium to remain in the blood.
Can they kick off some of the calcium?
Yeah, once you start correcting the pH or why this person is producing more hydrogen ions than normal.
Like through exercise?
No.
So when you're not producing too many hydrogen ions, it's balanced in the albumin?
Yeah, that's what helps maintain that calcium level of 9.5 to 10.5. Now, let's say, for example, that for whatever reason, who cares, the cells of the body are producing less hydrogen ions than normal. You have an alkalosis. Where do you have extra hydrogen ions that could become free floating? On the albumin. So the albumin will give up those hydrogen ions to increase the pH, yes, or decrease the pH, and that leaves an extra seat for calcium to bind. So an alkalosis causes hypocalcemia.
So that would be the opposite effect.
Correct.
Heart rate.
Absolutely. Absolutely. How many people followed this? I want that whole thing. Watch. I always put a couple softball questions on the quiz so that you can feel good about yourself. Hey, I know that one. Yeah? Acidosis leads to hypercalcemia. I just explained to you why. Cal. How do you spell it? Cal. I did it right. Right? Alkalosis, a basic pH, leads to hypocalcemia. You're gonna explain this, right? Now watch. Watch. An acidosis in combination with the hypercalcemia decreases neural activity. What's the lowest neural activity you can have without being dead? Coma. Work the logic here, work the logic. An alkalosis causes hypocalcemia, and that increases neural activity. So what's the most neural activity you can have without dying? Seizures. How many people are with me? So when people, and this has happened in this particular class, not this class, but the advanced class, people come in and they get scared and they start hyperventilating. They start blowing off more CO2 than they're actually producing. So what's going to happen to their blood? What's going to happen to the pH of their blood? You're getting rid of more CO2 than you're producing. What's going to happen to your pH? Say it real loud. Your pH is going to go up, right? You're going to get an alkalosis. So they will start doing this. They'll start having a seizure. And then I just close the door. So watch. If somebody's hyperventilating and they go to the emergency room, they will give them a paper bag and they will tell them to put it over and breathe into a paper bag. The reason they have them do that is because they are rebreathing their CO2. And it is the change in pH that causes all the symptoms. So by rebreathing their CO2, their pH comes back down and then they ambulate home. Tell me you got that. They use a paper bag because it's porous. If you used a hefty bag and put it over their neck, they would die.
If you had some
study and watch the videos, you won't panic. How many people followed that? Yes or no? You got it? I want that whole thing. If you don't know what I want, you better start emailing me that stuff, right? No excuse. Okay, hang on, let's look. What's a chemical buffer? It's a chemical that prevents swings in pH. Binds hydrogen free floating. Let's go with free floating hydrogen ions, right? Two systems, I did that. Briefly explain how the two systems help maintain the pH of the blood. Respiratory controls carbon dioxide. Kidneys control bicarbonate. Say yeah. Rock on. What happens to neural activity if the blood becomes acidic, alkalotic? Bam, did that. Watch it. Explain the changes that occur to blood levels of calcium if the pH becomes acidic or alkalotic. Did I do that? Yes, I did. So, this one's done, this one's done, this one's done. Say yes. Oh, and 6. Boom. How many people got that?
You did 4 too.
Oh, I went over the electrolytes?
Yes.
Oh, I did. Rock on. Excellent. Well, we're killing this. We can have the quiz today.
No. Heck no.
How many people got that? Number 1 is on your handout. Hang on. There it is. The goal of the body is to maintain homeostasis. The body works on a concentration gradient. Stuff always moves from high concentration to low for the most part. And the body always does stuff that makes sense. If the body is doing it, it makes sense to do it. Right? Boom. Those are the 3 fundamental principles of the body. I did that. Yes? Okay. Did I talk to you about proteins at all? Here we go. I went over pH. That's a big one. That's a huge one. And then, again, that's going to follow you forever. Forever. Yep.
How does the body prioritize between like albumin and bicarbonate?
It will use up the bicarbonate first, and then it will start using the albumin.
That happens pretty fast.
It happens very fast. Very fast. Okay. Hang on. All right. What I'm going over right now, I have to go over in order to lead you to where I want you to be for the next couple of questions. So this is kind of like introductory information. Okay? You ready? Okay. And if you had my general class, then you can update your Facebook status, because this is pretty much going to be a review for you. Now watch. In the body, there are 2 major classes of compounds. What are they? What are they? That's right. So we talked about the inorganic compounds, and how are inorganic compounds held together? Ionically, right? And ionic bonds are weak, so when they're dumped in water, they break apart. That's what forms electrolytes. Okay? What we're really made the most of is we're made most of carbs, and the big carb that you need to know about is glucose, right? We're made of these guys called amino acids, yes? And then we're made of fats. Are Are you with me so far? You don't need to know the structure of this. You just need to know that these guys are organic. They contain carbon, hydrogen, and oxygen chemically bonded together. And by definition, that makes it organic. You got me? Carbon, hydrogen, oxygen, chemically bonded together, just in a different way. Here, you got carbon, hydrogen, oxygen, chemically bonded together, but in a different way. Say yes, you're with me. Okay. The other organic compounds that you need to become familiar with are called the nucleic acids. And this is where people mess up, so I'm not going to mess you up. I'm going to try and help you. So here we go. Watch. Nucleic acids make DNA, RNA, or tRNA. You got me? The amino acids make protein. And the two major classifications of protein are structural and functional proteins. Are you with me so far, guys? The structural proteins, real simple stuff, right? Watch. Hair, nails, collagen, all that stuff. You got me? Did I go over this? Oh, you watched the video? Oh, see, that's good. Now you feel better about yourselves, huh? That's good. What are the functional proteins? Ooh, I thought you watched the video. Nice. Number one, you have enzymes. And number two, you got hormones. See, yeah, you're with me. Okay, now watch. Watch. What are enzymes made out of? Made out of proteins. What are proteins made out of? Amino acids, what? Chemically bonded together. Say yes. You better get this. Here we go. This is important. What inside the cell tells the cell what proteins to put together? The DNA. Tell me you got that. Okay. What you need to know, and wow, this is where people lose it. This is where it begins to end poorly. I'm being honest. You don't want it to end poorly, so you need to pay attention to this and you need to get it. That's why I made a video on it. You got me? Watch. Think of enzymes as little workers. Enzymes inside your cells control all. Did I emphasize that enough? Good. Perform all the chemical reactions inside your cell. You got me? How many people have heard of lactose intolerance? When you have digestive enzymes. If you're lactose intolerant, you lack the enzyme lactase. So you cannot digest the sugars found in dairy products. Tell me you follow that. So enzymes are specific. They perform one chemical reaction, and then that's it. Are you following me? You're with me. Yeah? What are enzymes made out of? What are proteins made out of? Amino acids what? That's very good. So watch. And you need to get this. And I don't know why you don't get this. I think it's me. I don't think you get it, but I think maybe you get it. I think. Watch. What's this? How do you know? Several livers. True or false? A liver cell performs different chemical reactions than a heart cell. That's very good. So in order to perform those different chemical reactions, what do they have to have inside of them? They have to have different enzymes. Tell me you're with me. You're following this. You got, yeah? You watched the video on this, right? So I can like fly through this, yes? Here we go. I'm flying. Right? There I am. I'm in the fetal position because students aren't getting this stuff, and I'm crying on the second floor of my house right now. Anyways, disgruntled students come over, burn my house down. I live on the street, hold a sign, will teach for food. You got me? The street of the body is your blood. You got me? Science doesn't have the ability, well, they do, but not routinely, to find out what's inside the cell. The only thing they know is what's in the blood. You got me? So if they stick a needle, if they stick a needle into your blood vessel, they're only going to be able to check what's in your blood. Tell me you got that. You're following this. So watch. In a heart cell, you got heart enzymes. They're specific to the heart. In the liver, you got liver enzymes. Say yes. So watch. With a blood test, a doctor can determine which organ of the body is being affected and to what degree that organ is being affected. Because really smart people with the tape and the pocket protectors, they figured out what specific enzymes are in each cell type. Say yes. If disgruntled students don't come and burn my house down, I can still live in my house. Yes? So if your heart is working properly and they were to draw blood on you, would they find any heart enzymes in the blood? No, because the cell membrane keeps the heart enzymes in the heart cell. But if your cells are dying and you are crying and don't know why, your cell membranes rupture and the heart enzymes go from high concentration to low. Tell me you got that. So if you work in an emergency room like Kim Chab does, there are enzymes and proteins in heart cells that when someone comes in for a heart attack, they check. They check troponin I, troponin T, CPKMB, LDH, and myoglobin. Should I go on? And what? Am I right? Of course I'm right. Watch. The more of the stuff that's in the blood, the more the heart is dead. More part of the heart is dead. That's why the doctor can come out and say, Grandma just had a little heart attack. Or, Elizabeth, I'm coming. This is the big one. Hi, people. Follow that. You know who will explain that to you? Smart people with tape and pocket protectors figured that out.
Well, where do I?
You can't. Only I have it. So if I tell it to you, then you'll know it. Now watch. This is important. And this is good. So I tell you this stuff, right? And then I happen to see you maybe at CVS or Pick and Save. And we won't even talk. We'll just walk by each other and go, because we know something nobody else does. Watch. When you get into pathophysiology, there was a list of lab tests. These are the lab tests that you will do to determine that. Now watch. Not all the time do they look for enzymes. They will actually look at the organ's function, right? So if its function is to do something and it's not doing it, that stuff that it's supposed to do will be elevated in the blood. Say yes. You followed this. I'm going to tell you this. I told you this before. I'm going to tell you it again because it's time now, right? This class is like me going to a fancy French restaurant. I have no idea how good that food is. You have no idea how good this information is. But you will. Say yes. You got that. That is, of course, beautiful. Here we go. What's hair made out of? Protein, right? Why is our body's temperature 98.6 and the pH of our blood 7.35 to 7.45? Oh no, we say what? Better write this down, better not pout. This is the important part of that video. I'm stringing together amino acids. Yes? I'm going to call this amino acid 1, this amino acid 2, and this amino acid 7. You thought I was going to write 3, didn't you? Are you with me? When the cell chemically bonds the amino acids together, strings them together, you form a what? You form a protein. Say yes. Now what's important to remember is that amino acids carry an electrical charge. I'm making this up. Positive, positive, negative. Making it up. So inside the cell, when the cell strings together, chemically bonds those amino acids together, are you with me? When those charges begin to interact, like charges repel each other, opposite charges attract. So this protein is going to begin to bend. Are you with me? And twist. Say yeah. I'm making this up. And it's going to have a particular shape. And the shape of the enzyme, in this case, determines ability to do its job. Say, that was on the video. Say it was, right? Good. I would never leave that off. That's why I'm going fast. Now watch. Watch. Hair is a protein. I'm going on a date tonight. My girl's coming down. Listen, this is true. When I go out to dinner, I don't wait. Did I tell you this? No. I do not wait. So I told her, I said, I'm going all out tonight, right? But we go to that restaurant, and there's 3 or 4 cars in that drive-thru. I'm not waiting. So I'm going to go on a date, right? And I'm going to plug in my curling iron, and I'm going to apply heat to my hair. What's it going to do to my hair? It's going to change the shape. So at what body temperature do the critical enzymes that control all the chemical reactions inside your cell, at what body temperature do they maintain their ideal shape? Okay, After class, I'm going to get a hair permanent. You got me? If you have straight hair and you want it to be curly, because Bob called, what did they put in your hair? They put acid in your hair. So by putting acid in your hair, it's going to alter the pH of your hair, and it's going to change the shape of your hair. Say yes. So why is the pH of the blood 7.35 to 7.45? Because the critical enzymes that control all the chemical reactions inside your cells maintain their ideal shape at a pH between 7.35 and 7.45. Can I get an amen? You don't think that's good? It's very good. So watch. This will happen to you. You work in critical care, you work in ER, right? Somebody comes in, let's say they were in septic shock or anaphylactic shock or something like that, right? And you don't get to them in time. You resuscitate them, they start breathing on their own, right? GI tract's working, and the doctor will come out and say to the family, look, there was nothing we could do. Even though their heart is working, their lungs are working, their eyes may be opening, the most critical enzymes that are most sensitive to temperature and pH changes are the enzymes inside neurons of your central nervous system. So even though the heart and all your other organs are working, the lights are on, but nobody's home. That's why high fever causes brain damage. That's why changes in pH cause brain damage. Say yes. You got that. And that's why fever is bad for you. Real high fever. Did I tell you about the dude with the fever of 107? Did I tell you about that? 1987. Do you remember that really hot summer when we had the record days of like 90, like 31 days of over 90? Do you remember that? It was in the late 80s. Watch, this guy's a roofer. He's working in Milwaukee. They think he's taking a break. He's leaning against the side of the building, right? He was in heat stroke. They brought him into St. Luke's ER. His core body temperature was 107.5, right? So what do you do when somebody has a core body temperature of 107.5? You try to cool them down. So you know what we did? We got a tub of ice. We gave him a drug called Pavulon. Pavulon paralyzes your muscles. Because even if you put an unconscious person in a cold bucket of water, they will begin to shiver. And contracting muscle produces heat and makes your body temperature go up higher. See, yeah. So, because the diaphragm's a skeletal muscle, you got to make sure he's on a ventilator before you give him the drug. Anyways, I'm working in the ICU. They call me up. They say, hey, Tim, you want to babysit this guy's second shift? I'm like, yeah. So they brought him up into the ICU. He was in the medical ICU. So I'm babysitting him. Before I started second shift, I went to a liquor store, bought 3 40s, and then threw them in the ice. I'm like, I'm not letting that ice go to waste. That guy walked out of the hospital. He was messed up, right? Like, mentally he wasn't too much there, but somehow that guy survived. I don't know how he did it. But once you start getting temperatures of 106, 107, it's over for you. And watch. What does heat do to the rate of chemical reactions? Speeds it up, right? So if your body temperature goes up, nerves start firing more frequently, and you get a febrile seizure. You know that information's solid.
What is that seizure?
How do you spell that?
I don't know. F-E-B-R-I-L-E, febrile. How many people followed that? Now watch. Fever good for you, bad for you? The body does stuff that makes sense. Fever, good for you, bad for you? What's the goal of the body? Fever, good for you, bad for you? Oh, hold up, I'm going to write that down. Watch, 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 watch. Anybody got a little baby? Anybody want a little baby? Remember, never forget this. The best part of kids is making them. I did triage in the ER down at Parkland, right? You know what triage is? People come in, I got a compound fracture on my left clavicle. Okay, you can wait. I got a hangnail. Ooh, gotta be seen right away. Right? You determine the level of severity of a patient, right? And you also handle calls. So this mother calls up, my baby's got a fever of 104.3. I'm like, yeah? Babies spike fevers like nothing. Do you know why? They're little. And have you ever seen a 2-year-old playing with their Lincoln Logs wearing a sweatband? The best way to dissipate heat is to have a big surface area and to sweat. Those kids can't do it. That's why they spike temperatures. So watch. So you call up the doctor. Doctor, my baby got fever. They say, alternate Tylenol and Motrin every 4 to 6 hours because you don't want to suppress the fever completely. You want the fever to go up, then give them some Motrin and come down and up and down because that's good for you. Say yeah. Who's sicker? A guy, 45 years old, right? Got a fever of 104, or a little baby got a fever of 104? The guy. And when guys are sick, listen up because this is true. They're babies. Oh, I got a hangnail. I think I'm going into a coma. They are. I saw this woman, man. She was sick. I know sick, right? She's holding her baby, right? Talking on the phone, writing out a check, and she's hacking up a lung. Guys, they're in bed, laying there. I can't move. It hurts. Women have a much higher pain tolerance than men. It is evolutionary. It is. If guys had babies, the population growth would be negative, and maternity leave would be like 9 years. You know, I'm still feeling that. And you find out, and this is no joke, when I worked in the ICU, I take care of women after heart surgery and guys. As soon as you got the breathing tube up, where's that morphine? Where's that morphine? Right? And the women, I go, are you having any pain? No. That's good. So if a woman's like hurting, she's hurting. If a guy's hurting, he's hurting and he'll let you know about it. See, you followed that?
Yes.
Okay. So, watch. What do enzymes do? My name is? No, not what they're made. What do they do? They control all the chemical reactions inside your cells, yes? And because, watch it, different cells do different things. What are they going to have inside them that's different? Enzymes. And that's how they can use blood tests to determine what's wrong with an organ. Say, yeah, you got that. That's beautiful. And they're temperature and pH sensitive because the shape of the enzyme determines its function. Anybody ever been into an operating room? Is it warm or cold?
Cold.
When you have somebody you cut open, people who are hot, but everybody's entitled to their own opinion. I know. If you're warm, you bleed faster. If you're cold, you bleed slower. And metabolism is slower when you're cold. When you're hot, metabolism's up. That's why it's cold in an ER. And watch, when people come out of surgery, they're cold. The reason they have a warming blanket is to get their body temperature back up to 98.6.
Do you know why after someone, this is kind of random, but why someone after anesthesia, their eyes are super puffy, like their face is kind of swollen?
Maybe the anesthesiologist hit them. It depends on what the surgery is. If it's like bypass surgery, people they hold on to like 30, 40 pounds of fluid. If you've ever seen somebody after heart surgery, have you seen it? You watch. If you ever work in a surgical intensive care, and you have the family come in, you gotta bring the chairs follow them behind, because they'll see the patient, right? They're like, ooh, and then they go down because they look like the Stay Puft Marshmallow guy. They're all puffed up, and they don't look it. You know what I mean? You saw them before they went into surgery, and then they look completely different afterwards. How many people followed this? You got this. For real? Oh, we can have this quiz.
No.
All right, let me do this real quick, even though I went over it. Good, you can tell me since you watched the video, right? My left arm's carb, my right arm's protein, my left leg's fat, right?
Yes.
You're doing that on purpose, aren't you?
No.
Forget it. I'm just going to tell you this. Watch. We're combinations of these organic compounds. If you take protein and carbs, what do you make? Protein and carbs. What? Say it real loud. That's loud. Watch, this is what it's going to be. Just so you know, number 20 on the quiz is extra credit. Watch. It is. Watch, everyone hold on. Now watch. If by some mistake I forget to put number 20 as extra credit, this is how it's going to sound. Hey Tim, you told me number 20 was going to be extra credit. See, that's how you like to talk, right? But when I ask you a question, if you take a carb and a protein, what do you get? That's beautiful. You better get this. Better not pout. Glycoproteins are what make up cell receptors. You got me? Ready? Please get this next idea. You got me? Is there a lot of stuff in the blood? That's good. Does everything in the blood affect every cell of the body in the same way? So watch. You want particular cells of the body to only be affected by particular stuff that's in the blood. right? So how the cell accomplishes that is by putting specific and different cell receptors on its surface. Are you following me? So a liver cell is going to have different receptors than a heart cell. So specific chemicals in the blood that affect a heart cell cannot affect a liver cell. Say yes. Real smart people with the tape and pocket protectors figured out the different types of receptors on cell types. You following this? Not only did they figure out the different types of receptors that are on the cell membrane of different cells, but they also found what chemical it binds to. So when they develop drugs, which you will be giving and have to know how they work, many drugs work by either stimulating a receptor or blocking a receptor. I give you an example. There's a receptor on the heart called a beta receptor. Are you with me? A chemical in the blood called epinephrine or adrenaline binds to beta receptors. Are you following me so far? Watch. If you get scared, what happens to your heart rate and blood pressure? It goes up. And that's because more epinephrine is dumped into your blood, it binds to beta receptors, and makes your heart rate and blood pressure go up. Tell me you got that. So if you have high blood pressure, a doctor could give you a drug that prevented epinephrine from binding to beta receptors. Is there a drug that does that? No, I made that up. It's called a beta blocker. Have you heard of those?
Yes.
Do you think you'll ever give a patient a beta blocker? No, it's ridiculous. All you'll have to do, critically ill or a broken toe, is rub their patella and they'll be better. So you better know where that is. How many people followed this? That's not important at all. Do you think? So what do you want from this little story here? Different cells, because they do different things, they will bind different chemicals from the blood. Therefore, they have to have different glycoproteins or different cell receptors embedded in their cell membrane. Say yes. Can I show you something just real quick? Don't write this down, just listen to this. What does your liver make besides bicarbonate? No, like what does it actually make? It makes cholesterol. You following me? Have you ever heard of a drug called Lipitor, Crestor, Zocor? Those drugs inhibit an enzyme that prevents the formation of cholesterol in the liver. It inhibits the HMG-CoA reductase enzyme. And this is no joke. After class, if you see a security guard and you say HMG-CoA reductase, they will give you their walkie-talkie. They'll just hand it to you. How many people got this? For real? Okay. So this is a mess. We handled carb and protein. What's next? What? A carbon fat. What do you make when you combine carbon fat? A carby fatty. You make a glycolipid. Yeah. Hang on. Glycolipids. An example of glycolipids are boogers. So you can tell your kids, quit picking your glycolipids. Apply what you learned. The other thing that glycolipids do is, watch. How come your immune system doesn't attack you?
Because it knows its cells, proteins, and all the things that it made.
How does it know that though?
It's
There's a group of glycolipids and glycoproteins on every cell membrane. And it's the same on every cell membrane. It's called the major histocompatibility complex. Don't just listen to this. And your immune system was told, if you see cells that have this major this group of proteins, you got me, on its cell membrane, you don't mess with it. Do bacteria or viruses or protozoa, do they have your group of proteins on their membrane? So that's how the immune system knows that ain't me, and I'm going to attack it. Say yeah. So if you need a heart transplant or a liver transplant, what histologists do is they look at that group of proteins and they try to find a donor who has as close as possible the same group of proteins. Sometimes it's a relative, sometimes it's a stranger in Guatemala. So that's how they determine whether or not it's a match. Tell me if you follow that. So the closer it is to the person's own group of proteins, the less likely the immune system is going to attack it and reject that organ. All right. What's the next one? Come on. You went over this. It's a fat and a protein. What's that? That's a lipoprotein. Fat and protein make lipoprotein. Give me an example of a lipoprotein found in your body. Cholesterol, right? Cholesterol is a lipoprotein. Do you need cholesterol? Of course, the body does stuff that makes sense. The liver wouldn't make it if you didn't need it. Say yeah. Okay. The final one is this. We're doing good. Man, we're going to knock this thing out. You know what I'll do? I'll bring the quiz number 1 over to your house on Sunday. And then I'll just sit there and watch a football game while you do it. Here we go. Ready? Ready? You can take an inorganic compound and a lipid. Add them together and you got an inorganic lipid. The one I'm talking about is, what's this? Phosphate. So if you take phosphate and you add it to lipid, what do you get? You get a phospho. How do you spell it? P-H. Phos. That's close enough. Did I spell that right? Close enough. You get a phospholipid. And you better know this. Phospholipids make up cell membranes. You learn this in general. That's why I'm going quick. Okay, here we go. Wait, where is it?
You said that makes up cell membranes?
Yes. I'm going over number 12. You got me? Number 12 is worth 210 points. 30 points for explaining each method of transport. Say yeah. I'm going to tell you this right now. Right now. That 3 of the 7 have to be explained. Ion leak channels, voltage gated channels, and the sodium potassium pump have to be 3 of the 7. If they're not, I'm marking the whole question wrong. Do you understand that? Am I clear on that? 3 of the 7 ways that you have to explain on that question are ion leak channels, voltage gated channels, and the sodium potassium pump. Are you with me? Okay. There we go. Did you look at this video? This is so cool. Let me give you so this is a cell membrane. And what we're going to do is look at a cross-section of the cell membrane. In this case, this cell membrane looks like spinach lasagna. Ready? So let me give you a little reference here. Here, you have the capillary. You got me? And then you have the cell membrane. All cell membranes are selectively permeable, right? So as you can see here, you have a phosphate head and a lipid tail, and a phosphate head and a lipid tail. The phosphate head attracts water. The lipid tails repel water. In your book, they talk about hydrophilic and hydrophobic. Do you remember reading that? So hydrophilic means that you like water. Water you can dissolve in water. Hydrophobic means you don't like water, so you can't dissolve in water. And in this world, you are basically one of 2 things. You are either water soluble or you are fat soluble. So whoever thumped this up had it going on. It's perfect. So what it does, it prevents stuff that's in the blood from willy-nilly going into the cell, and stuff that's in the cell from willy-nilly leaving the cell. If the thing is supposed to go from the blood into the cell, there is going to be a way for that thing to go from the blood into the cell. And if it leaves the cell, there's going to be a way for it to leave. Tell me you got that. Okay. Now watch. So let me give you a little more reference here. So you got the capillary. What's the space between the capillary and the cell membrane called? That's called the interstitial space, right? So anything that's inside the cell, that's trapped by the cell membrane, that's intracellular. And anything outside the cell is extracellular. And extracellular includes the interstitial space and the blood. In this class, I do not differentiate between the 2. It's either in the blood or it's in the cell. Say yes for simplification. All right, so watch. Do all cells need oxygen, and do all cells produce carbon dioxide? Yes. So if you need oxygen and all cells need it, it wouldn't make sense to have a special way for it to get in. So oxygen can simply diffuse. So one of the ways that stuff can get into or out of a cell is simple diffusion. Stuff, in this case oxygen, moves from an area of high concentration through a selectively permeable membrane to an area of low. You got that. Where's carbon dioxide highly concentrated? Where is it lowly concentrated? So diffusion works both ways. It depends on the concentration gradient. If stuff's high in the cell, it's going to go into the blood. Stuff's high in the blood, it's going to go into the cell. Say yes. So one of the ways that stuff can enter or leave a cell is through simple diffusion. Say yes. And what are the two things that simply diffuse? Oxygen and carbon dioxide. All right. This is why I made you do this. Where's sodium highly concentrated? Always. Where's potassium always highly concentrated? Can potassium willy-nilly go from the blood or from the cell into the blood? Can sodium go from the blood into the cell? No. So if you need to get sodium in and potassium out, there has to be a special way to do that. Are you with me? Embedded in all cell membranes are protein channels that go through the entire thickness of the cell membrane. These little protein channels are specific. Are you following? This is a sodium ion channel. What's the only thing that can go through a sodium ion channel? No, potassium. And where does sodium go? Why? So one of the ways that a substance, in this case an ion, can get into the cell is through a specific protein channel embedded through the cell membrane. So this is called a sodium ion channel. Say yes. Who's with me? Yeah? Where does potassium want to go? I don't even have to do it. I shouldn't have to do it. How does potassium go from the blood into the cell? Right. Cut it out. And that is a protein channel that's embedded through the thickness of that cell membrane, and it will only allow potassium to leave. Potassium can't go through a sodium channel. Sodium can't go through a potassium channel. Are you with me? Now, in some cells, especially muscle cells of the cardiovascular system, there's additional ion channels. And those additional ion channels are calcium ion channels. And where's calcium highly concentrated? In the blood, for this case. Are you with me? So where does calcium want to go? How does calcium go from the blood into the cell? Right. Tell me you got that. Again, major moment in your life, your educational life. Are you with me? Right? Watch, this will come back and haunt you. You know what I want, though? You know what I'd like you guys to do just one time? Come back when you're in clinical and you're struggling because you didn't pay attention to this stuff. And just let me tell you, I told you so. Just let me do it one time. Okay, watch. Write this down. Never forget it. Ready? I don't blame you. Ready? muscular contraction is calcium. The heart and blood vessels rely almost exclusively on calcium from the blood to contract. How many people are with me? So if this is a heart cell and you want the heart to contract harder, you have to get more calcium into it. How does calcium get into your heart cells? Through calcium ion channels. Are you with me? The more calcium that gets in, the harder the heart will contract. If the heart contracts hard, what happens to the pressure that it can generate? It goes up. So if you have a patient with high blood pressure, you could give them a medicine that blocked calcium ion channels in the heart. And if you gave them a medicine that blocked calcium ion channels in the heart, would the heart contract as hard as it did before? So what would happen to the person's blood pressure? Go down. Is there a drug that blocks calcium ion channels in the heart? What is it? They're called calcium channel blockers. Are you kidding? Your cup runneth over with calcium channel blockers. Hold up. There is. Wait. There. I got it. There's verapamil. There's cardizem. Have you ever heard of these? Procardia. Have you heard of them? Amlodipine. Norvasc. Have you heard of those? Those are all calcium channel blockers. Do you ever think you'd give a patient a calcium channel? I just taught you pharmacology. Do you know how good that is? You know how good that is? You know who'll explain that to you? But you're going to explain it to me, aren't you? All right, ambulate home. Did enough. You guys better watch those videos, better study. There's 18 people in this class. At the end of the semester, there ain't going to be 18 people. Just so you know.